Hello everyone, welcome back to another session under biochemistry, that is lipid profile. So what are the objectives of our presentation? Lipid profile, which consists of total serum cholesterol, serum triglycerides, HDL cholesterol, LDL cholesterol, and last we need to talk about regarding our nursing implications. So what is lipid profile? Lipid profile test or lipid panel are used to estimate increased risk of cardiovascular disease. Mainly, the patient will undergo this lipid profile test or lipid panel. These are to estimate the increased risk of cardiovascular diseases. A lipid profile test is performed to measure. So what are in this profile, what is the investigation we are going to notify? Total serum cholesterol level, serum triglycerides, HDL, that is known as high density lipoprotein cholesterol, LDL, low density lipoprotein cholesterol. Then whenever a patient is taking are undergoing this lipid profile, blood should be collected after 12 hours fast. No food or no drink except water. So here, whenever the patient is coming for lipid profile investigation, the blood should be collected after 12-hour fast. The first one is total serum cholesterol. Blood cholesterol is estimated by enzymatic method. Some of the chemical methods we are using for estimation of the cholesterol level. So normal values and interpretation of cholesterol. So we have to know regarding what is the normal value of cholesterol levels. The normal range for healthy young adult is below 200 milligram per deciliter. So what is the normal serum cholesterol level? It should be below 200 milligram per deciliter. And it may be lower in children. The concentration increases with the age. So this cholesterol level may increasing with the age. The concentration in women is generally somewhat lower than in the men. Initially, woman is safer side. So but whereas when she attained menopause, the both gender will be having both same risk factor under cholesterol. Increased concentration of cholesterol, in which cases the cholesterol level is going to be increases. The total concentration is increased in hypothyroidism, uncontrolled diabetes mellitus, extrahepatic obstruction of the bile duct, various hyperlipidemias, and nephrotic syndrome. And long-term elevated cholesterol concentration that is greater than 240 milligram per deciliter. So what do you mean by longer elevated cholesterol concentration? It may be greater than 240 milligram per deciliter is a high risk factor for the development of coronary artery disease. If the patient is unable to control his cholesterol level, what will happen? He may be prone to developing the coronary artery disease. We know the importance of the coronary arteries, which is giving more blood circulation towards the heart. Whereas the arteries is getting blocked by this fatty deposition, patient may be having heart problem. Lowering of plasma cholesterol concentration reduce the incidence of coronary artery disease. If the patient is controlling his plasma cholesterol concentration, he is the he may not having risk factor for coronary heart disease. So according to National Cholesterol Education Program, what this program is explaining, National Cholesterol Education Program NCEP define the level of serum cholesterol believed to be desirable. It should be always desirable and tolerable or a risk factor for development of coronary artery disease. If the level is not desirable or not as like tolerable, the patient may be suffering with the coronary artery diseases. Then serum triglycerides. Serum triglycerides is denoting with the TG is estimated by enzymatic method, normal value and clinical interpretation. The normal range of serum triglyceride is 40 to 145 milligram per deciliter. So what is the normal triglyceride value? It should be 40 to 45 milligram per deciliter. Increased concentration of serum triglycerides. So what will happen? Elevated concentration is often found in disturbances of lipid metabolism. If the patient is having any lipid metabolism disturbances, we can notify there is a increased concentration of serum triglycerides. And in atherosclerosis and coronary artery disease, elevated concentration is found in disturbances of lipid metabolism and in atherosclerosis. In previous classes, we have discussed regarding what do you mean by atherosclerosis. Atherosclerosis, hardening of the blood vessel because of the fatty deposition. And another condition is coronary artery disease. The diseases may be occurring to the coronary arteries. The serum triglyceride concentration is greatly elevated in hyperlipoproteinemia. Hyperlipoproteinemia. Hyper meaning is increasing. Lipoproteins, the proteinemia, emia in the blood. So the protein content is going to be increasing in the blood. So the cause of hyperlipoproteinemia is a genetic origin, but hypertriglyceridemia occur commonly secondary to the following conditions. What are they? Hypothyroidism, nephrotic syndrome, alcoholism, obstructive liver disease, acute pancreatitis, uncontrolled diabetes, glycogen storage disease, that is also known as under type 1. Then decreased concentration of triglycerides. The plasma triglyceride concentration is low in rare disease, that is A beta lipoproteinemia, absence of low density lipoprotein. So in which cases decreased concentration of the triglycerides we are notifying here. The plasma triglyceride concentration is low in rare cases, that is known as A beta lipoproteinemia. This is meaning is absence of low density lipoprotein, that is also known as LDL, low density lipoproteins. Then coming to the other factories or under this profile, the another investigation is HDL cholesterol. HDL, high density lipoprotein. High density lipoprotein cholesterol is estimated by a commercial kit. The normal values and clinical significance of HDL cholesterol, that is serum level of HDL cholesterol. So why we need to notify this? Uh, the men is 30 to 60 milligram per deciliter. His cholesterol, HDL cholesterol, it is also known as good cholesterol. The value should be 30 to 60 milligram per deciliter. Whereas woman, it should be managed 40 to 80 milligram per deciliter, which is 20 to 30% higher than the men. Studies have indicated that when the HDL cholesterol value is below 45 milligram per deciliter in men and below 55 milligram per deciliter in women, there is an increased risk for heart disease. Now, we understood here, according to some studies, what they are explaining, HDL cholesterol value below 45 milligram per deciliter in men, whereas below 55 milligram per deciliter in women, there is an increased risk for heart disease and the relative risk increase with the lower HDL cholesterol concentrations. Higher HDL cholesterol concentration may be associated with decreased risk of coronary disease. So what they are telling here, higher HDL cholesterol concentration may be associated with decreased risk of coronary heart disease. In our body, HDL cholesterol is good amount, so we will be free from the coronary artery disease. And thus HDL cholesterol level are inversely related to the risk of cardiovascular disease. If we are managing our good cholesterol is properly, we are free from the cardiovascular diseases. Then high density lipoprotein cholesterol level above 60 milligram per deciliter indicate very low risk for coronary artery diseases. It's also known as CAD. So what is the meaning of here? When we having this high density lipoprotein cholesterol level above 60 milligram per deciliter, which indicates we are very low risk for coronary artery disease. So whereas high density lipoprotein below 35 milligram per deciliter increase the risk of CAD. So always our HDL cholesterol should be managed above 60 milligram per deciliter. If it is goes below 35 milligram per deciliter, we are the risk factor for coronary artery diseases. The ratio of total cholesterol to HDL cholesterol gives a more accurate and definitive assessment of heart disease risk. Decrease in levels that are associated with stress, obesity, androgen, cigarette smoking, and diseases as like diabetes mellitus augment the risk of coronary artery diseases. So now we see this, the ratio of total cholesterol to HDL cholesterol gives a more accurate and definitive assessment of heart diseases, heart disease risk. So the decrease in levels that are associated with our HDL level is decreasing, in which cases when you are having prolonged stress, obesity, androgens, when we having habit of cigarette smoking and diseases like diabetes mellitus, they are augment the risk of coronary artery diseases. So what do you mean by androgen? Androgens are the male sex hormones. And the another one is LDL. LDL means low density lipoprotein. So the value of LDL cholesterol may be calculated if the concentration of total and HDL cholesterol and triglycerides are measured. What they are telling here, the value of LDL cholesterol. LDL cholesterol may be calculated. How we are going to calculate this LDL? If the concentration of total and HDL cholesterol and triglycerides are measured. In practice, LDL can be measured indirectly by use of Fried-Wald equation, assuming that total cholesterol is composed primarily. First, we need to composing total cholesterol levels. So we can apply the formula here. Total cholesterol is equal to cholesterol in VLDL. What do you mean by VLDL? Very low density lipoproteins plus LDL. Low density lipoprotein plus HDL. HDL means high density lipoprotein. So if we need LDL value, LDL cholesterol is equal to total cholesterol minus HDL cholesterol plus 1 by 5 into triglycerides. The concentration of all constituents should be expressed in the same units as milligram per deciliter or milligram per liter. 1 by 2.22 into triglycerides is used when LDL cholesterol is expressed in millimole per liter. The factor 1 by 5 into Tg triglycerides is an estimate of the VLDL cholesterol concentration. So normal values and clinical interpretation, the LDL cholesterol in women is somewhat lower than in men but increases after menopause. So what the concept of here? The LDL cholesterol in women is somewhat lower than in the men, but whereas it increases after menopause. You know the terminology of menopause? Menopause indicating complete cessation of menstrual cycle by the woman after attaining the age over 50 or 45. Low level of LDL cholesterol lower the risk. If you're having the LDL, this is also known as bad cholesterol. If this bad cholesterol is less in our body, we are low risk for cardiovascular abnormalities. Values between 130 and 160 milligram per deciliter are in borderline risk. Values below 130 milligram per deciliter are safer side. Thus, the risk of cardiovascular disease is correlated directly with a high concentration of LDL cholesterol. The highest correlation have been obtained as a risk factor by the risk ratio of LDL cholesterol to HDL cholesterol. It's always, if our in our body HDL is more, then obviously LDL will be decreases. If our body LDL is more, HDL will be decreases. Vice versa, always opposite. HDL is increasing, LDL will be decreases, or LDL will be increasing, HDL will be decreases. So that's why we need to manage our HDL cholesterol level a good amount, because if we are having good HDL, we are free from heart problems. Then coming to nursing implication, as we nurses, we need to understand what is the importance of this lipid profile in the clinical area. The lipid profile screening is one of the most complete, accurate and trusted screening procedure. Then a lipid profile screening is used to identify lipid levels including total cholesterol, HDL cholesterol, LDL cholesterol and triglycerol in blood. Abnormal lipid profile levels are strong indications of risk of heart disease including heart attack, stroke and death. Unfortunately, abnormal lipid profile levels show no symptoms. Unlike many disease, abnormal lipid profile may be silent. Sometimes we may not having the symptoms of abnormal lipid profile. And lipid profile is a simple and accurate way to determine the risk of developing heart disease, stroke or sudden death. A professional nurse. Being a professional nurse, we take a few drops of blood sample from a fingertip and place it in a blood analyzer. In just a few minutes, a patient will know lipid levels including total cholesterol, HDL cholesterol, LDL cholesterol and triglycerol in blood. High level of LDL or bad cholesterol, high level of triglycerol, low level of HDL or good cholesterol are considered abnormal and may be life-threatening. So these are the normal ranges which is given by the references. So normal category, normal desirable safer serum cholesterol below 200. Then borderline high risk 200 to 240 milligram per deciliter and high risk above 240. Then here you can see this total ratio of HDL cholesterol and LDL cholesterol for assessment of risk of coronary artery disease. So in the category wise safer side, in the men 3.40, borderline 4.95, high risk 9.50 and women it should be 3.25, then borderline 4.45 and high risk 7. So let us summarize our topics. In a nutshell, we have discussed regarding lipid profile. So whenever we see the lipid profile report, we have to notify the different kind of investigation. So what are they? Total serum cholesterol, serum glycerides, HDL cholesterol, LDL cholesterol. So here HDL cholesterol is considering as a good cholesterol, LDL cholesterol is considering as a bad cholesterol. When you are managing in our body abundantly good cholesterol, we are free from heart diseases. If we are having LDL cholesterol in our body, we are always risk factor for development of the coronary artery diseases. I hope my dear students you understood the concept of the lipid profile and we meet once again. Have a nice day.